Okay. Good morning, Jeff Christofak. I am with Sidecar Health, the director here in North and South Carolina. And today I want to tell you about our new startup called Sidecar Health. I've been in the business now for about 13 years. I transitioned over from United Healthcare to Sidecar in June. So I've only been here about 3 months, but what I found out is, and what I think everybody in this room and around the country has found out about healthcare is health insurance is expensive because healthcare is expensive. And that's the bottom line. Everybody talks about the word transparency. Well, we help bring that to the market. And the way we have gone about doing this is we have decided that if we can somehow get a product where cash is king into the market and then make sure we cover everything just like you would a major medical, then we feel like there's an opportunity, and that's exactly what's kind of transpired here for us. And so we go down to what we call the billing code level, right? And so by doing this and assigning a cash price to everything in the market, and then giving you the ability to shop the market, then we feel like we've got some type of an opportunity here to really make an impact, in the market. And then what we did is, as well as doing that, is we didn't create a product with a network. We did create a product, with price and coverage transparency. So we have a tool that I want to show you that can help you along the way in terms of finding, the right care for you at the right time. We didn't want to have any limitations like you normally would see with other health insurance products that come to market. And because we have low overhead, we don't have a big claims staff, right? Because at the end of the day, you're finding the cash price and then taking that cash price into the market to try to find the best care. We're able to provide, lower premiums. The best part about the product is as you're searching for where to go for care and seeing the cost up front, when your claim gets adjudicated after the visit with the doctor, if you are a wise shopper with us, right, and you spend less money than the reimbursement, then the cool part about the product is you get to keep the change. We call it in your pocket. So it's not a reimbursement. You're not profiting off of us. We're providing a benefit to you with regards to that particular procedure that you've gone and you've had. One of the things I like to always point out, with our product is, we have certain benefit amounts, right, based on going down to the billing code level. And then doctors and hospitals charge, their prices as well too. So, in the middle here is our actual cost for these procedures, which is, which is really cool. And then once you get those prices, it's up to you again as the member to shop the market. And if the provider, hospital, doctor, or pharmacy charges less, these are actual known procedures as an example, and you keep the difference and that goes in your pocket and you get that back in the form of a check if you want, or you can use it to pay premiums. So it's a really cool concept in and of itself. So as far as a solution for us, where do we fit into the marketplace? Mostly we are an individual product. You're individually underwritten, but you can put this in smaller groups. Everybody's got to qualify on their own merits. We're a fantastic opportunity for PEOs, associations such as realtors, dependents on groups, right? That the employee can't afford, for the dependent coverage, but they can cover themselves. And then part-time employees as well. You could even have this next to a traditional product in the market that you're used to as well, such as a health savings account, which I know you're familiar with that term if you wanted to. So there we go. We're currently marketed right now in 11 states, as you can see in the dark green, trying to get into the other 6 below, hopefully by the end of the year, and also including maternity coverage as well too. So as far as the technology goes, we built it from the ground up. in terms of finding out what the average cash price in the market is. We do that through member outreach, through our member care team. We do that through conversations with hospitals, providers, asking what their cash prices are. Even for those on the call that are tech savvy, crowdsourcing. Each person on our product gets a Sidecar Health debit card to help pay for claims up front, because we realize you have to file for it still on the back end. So as a courtesy, if you qualify, you can use our claims bucket. So we're getting it through crowdsourcing, and then also we get it through file feeds as well too. So this is our company as a whole right now, based in California. I'm here in the Carolinas. We've got 4 other directors here around the country. So slowly but surely, we are moving in the right direction. Very excited about the fourth quarter. As you know, so goes the fourth quarter in health insurance. So goes your year, so to speak, because everybody renews around this time. So things are starting to really heat up for us. So interested to see how well we do, considering we've only been around since really selling since December of last year. So what I want to do right now then is I want to stop there, and I want to share my screen because I want to show you what our technology looks like, because at the end of the day, I can talk all day long about cash, discounts, and underwriting, but to really see what we're about is to see our technology. So if you're an individual, you qualify for our product, this is the dashboard that you'll see, okay? And then get care right here is where I want to go. Again, we go down to the billing code level, so over 170,000 CPT codes, every type of prescription drugs covered in the market. So I'm going to go here very quickly and show you a common statin called Crestor, right? And let's say you're a wise shopper and you're going to take the generic drug, okay? So this is the really cool part. This is what gets me out of bed every morning, is this right here. And I'm tied into the network in LA, so I need to CORNCORNIUS. Apologize, guys, I can't type this morning. Okay, so for this particular prescription drug, if you were on Crestor and you wanted to take the generic, you get a script for it, right? So based on the form, dosage, and quantity, the average cash price we know in the market through our file feed with our PBM and outreach, as I suggested, is $20. We pay 80% of everything that we filed in the market, as I stated, so $16. And since we have no network, you're more than welcome to go wherever you want to fill this prescription drug. So we partnered in unison using Google Maps. So you could click on any item you wanted here, but I always like to come down here because it's cleaner. And it shows you, it says the cash price is $20. This pharmacy though, Publix, which is right down the road on Magnolia Estates, right across from the Peninsula, charges only $10 for the pharmacy, that prescription drug. We're going to pay $16. So what ends up happening here is at the point of sale with that debit card that we give to every member, they're going to give that to the pharmacist, okay? Point of sale, that transaction's complete. You'll get a notification to upload a copy of that bill. We'll adjudicate that claim in anywhere from 1 to 4 days. And because you were a wise shopper and spent less than what our fixed reimbursement was, that $6 goes in your pocket. So that's a real easy look at a prescription drug. Another one real quick here too is a doctor fee. So average cash price in the market is $165. The plan pays $143. You can go wherever you want. Since we're new to the market right now, I don't have a lot of data analytics like I do for pharmacy. So as an example here, there's a lady in Denver that charges $140 to walk through her door, so you'd make $3 back. We started in Houston, Texas, or Texas in general, and as you can see, by the way, the cash price changes around the country, just like it does with Medicare rates, but our reimbursement is still going to stay fixed at 143. But my point being is, when we start to get more folks on this product and we go through a fourth quarter, we'll start to see more data just like this with the card. But for instance, here you can see with our reimbursement, folks in Houston have a plethora of opportunity to go to doctors that charge less just to walk through their door. And it very well could be this would be the only charge for the visit. So members stand to make some money in their pocket. But the whole concept and idea of our product is transparency, helping those individuals that are healthy, that can qualify for this product. And then at the end of the day, giving you the ability with our transparency tool to shop the market because it's so desperately needed in healthcare today. And hopefully we'll be able to make a real big impact and help people live healthier lives.
Awesome.
That's my presentation.
Thank you, Jeff, for being here.
Welcome. Thank you.
So I've worked in a lot of different healthcare situations and stuff like that. So I think this is an important shift that needs to happen in the healthcare market, because we all know there's a huge amount of waste and overspending and all that kind of stuff. So we have to provide that transparency and make the consumers aware of these options that are out there and stuff. So kudos for you for trying to take a crack at it in this unique way. I guess what is something that Sidecar is struggling with to get traction on, or to make it go faster?
Yeah, I just think like any other startup, especially in the very early stages with a product that's, I mean, quite frankly, it's unique, but it's not really unique to the market in